Hi, I'm Alexandra Branzuela, and I will be discussing the impacts of Medicaid expansion among women in the United States. So in 2010, the Affordable Care Act was passed, which expanded the coverage of Medicaid, meaning that the population with income below the 138% of the federal poverty line is able to receive healthcare insurance. Initially, this was meant to affect the whole country. However, states were then given the option to opt in Medicaid expansion or opt out. States that opted in are shown in blue, and states that opted out are shown in orange. And you could also see that the uninsured rate among states that didn't expand are much higher than those that did expand. Ultimately, state-run Medicaid expansion is able to help close the gap in access to preventative healthcare services for low-income women by expanding healthcare insurance accessibility. So the first study I looked at is a cross-sectional study that used data from the 2012 Behavioral Risk Factor Surveillance System, which is a national health survey. And the purpose of this study was to assess how Medicaid expansion potentially impacts disparities in preventative care for low-income women. And this study compared self-reported screening with state expansion status for uninsured low-income women and used logistic regression to assess differences while controlling for demographics. Results from this study indicated that women living in non-expansion states had significantly lower odds of receiving recommended mammograms and pap tests than women who live in expansion states, which shows that differences in Medicaid coverage across states ultimately really affects women who live in states that opted out of Medicaid coverage, since they were really less likely to receive screenings than those that lived in states that expanded. The next set of studies I looked at were difference in difference studies to assess pre and post Medicaid expansion. Specifically, this study used data from the 2011 and 2016 BRFSS, which is the same health survey used in the previous study. And this study assessed outcome indicators, which were the ability to afford needed healthcare, having a personal doctor, use of healthcare services in the past year, attending screenings for breast, cervical, and colon cancers, and to assess socioeconomic status, the authors used household income. Results from this study indicated that the socioeconomic gap in individuals reporting financial ability in accessing healthcare, having a personal doctor, and receiving routine checkups was reduced after Medicaid expansion. So these results indicate that expansion did help those of lower socioeconomic status. Here's the data with that. And lastly, I wanted to address the disparities that really affect access to care and receiving health insurance. So this study is a difference in differences study that uses data from the Medical Expenditure Panel Survey, which is drawn from a nationally representative subsample of households. And this sample is non-elderly, low-income women living in the US from pre and post Medicaid expansion, and women from expansion states and non-expansion states. This study examined trends of outcomes before and after Medicaid expansion and controlled for risk attitudes and preference structure covariates. Multilinear regression was used to estimate the effect of policy change, and the estimate suggests that there was no significant change in mammogram utilization and pap tests among low-income women post-Medicaid expansion. However, Medicaid enrollment did increase significantly among low-income women living in expansion states. And a majority of women who obtained tests were of high income. I believe this study contradicted many previous studies due to the result of no significant increase in screenings and tests, which were shown in the other studies discussed. So I wanted to address the limitation that there's a possibility that a significant amount of women may have received screenings through sources not accounted for, such as the National Breast and Cervical Cancer Early Detection Program. through the CDC, which were accounted for in previous studies. Additionally, there could be a lack of awareness of preventative services and benefits through the Affordable Care Act, as well as requiring cost sharings for services may be reasons that low-income women are not receiving the screenings. So shared strengths of these studies are very large sample sizes and nationally representative data sets, which suggests that results would indicate effects of policy change for the country as a whole, as well as using previous literature to assess the validity of measures used in the study. Limitations are potential bias due to overreporting and self-reporting, and a possibility of excluding the poorest populations in surveys due to them being collected through electronic devices such as computers and telephones, which the poorest population would not have. So to conclude, while Medicaid expansion did help increase the number of people with healthcare insurance and increase the amount of women who receive cancer screenings, there are so many disparities that need to be addressed to have a larger impact and see real change. So in the future, more studies should look at disparities that prevent access to care within low-income populations. Additionally, I'd like to see implementation of programs among low-income populations that raise awareness of preventative health behaviors and preventative services that could help increase screening rates and ultimately improve morbidity and mortality among women in the United States. So thank you for listening, and these are my sources.